You're going to have different wounds. Some of you are going to have abdominal wounds. Some of you are going to have a leg wound, okay, that's here on the side. So you'll have to bend the knee because when we irrigate it, we want it to drain down, okay? We don't want it to pull in the wound. We want it to drain out. So you're going to have that. This one is an abdominal wound. So, of course, I would start with my chart, okay? I'm looking at my chart to see where my wound is, what kind of wound, how old this wound is, did they just have surgery, and when were they last medicated, okay? Because it's painful. Some of I brought this as an example, some wounds that we pack, we use iodoform gauze, and if it's medicated, it burns, okay? When we put it in there, it burns for at least 20 minutes or so after we packed it. It should get better after that, but it does burn, okay? So it's not fun. And when we take off the old dressing, if it sticks, if it has dried out, it hurts. So we don't ever just jerk that gauze out of there because that pulls away all the new tissue they've just grown. So we would wet that with normal saline, okay? So I've looked at my chart. I've decided this patient had an abdominal wound that had an exploratory lap, okay, we'll say that. And it was 2 days ago. And it's been 6 hours since they were last medicated. So I come into the room, I perform my entrance routine, okay? What I'm going to add to this, because I'm going to be doing this dressing and using tape and gloves inside their body. Are you in the screw?
No, ma'am. We're trying to figure out, are we supposed to be taking the quiz first or watching?
The quiz first.
Okay.
Quiz first, thank you. Okay, so I would go through my entrance routine, ask about, identify my patient. I'm going to ask his level of pain. It is a guy, Mr. Watkins. Mr. Watkins, are you having any pain right now? I noticed that the last time you were medicated was 6 hours. What's important to know is, did this procedure, the last time they did it hurt him? If so, we're going to medicate him before we do it, okay? So don't forget to ask that. And then, of course, we'd wait 30 minutes. So let's say he's hurting. It did hurt him the last time, so I've medicated him. I'm going to wait at least 30 minutes to come back. I also need to know, Mr. Watkins, are you allergic to any medicines? Are you allergic to any tape or latex? Because I'm going to be touching him in his body with latex gloves and applying tape, okay? So those are things we're adding. Don't just ask level of pain, but ask if he has allergies to latex or gloves, or tape, okay? We're going to use paper tape on the mannequin because the other tapes you cannot get off of them, okay? There's a great tape that we would normally use in the hospital. We use microfoam a lot because it's a surgical tape and it works the best. All right, so I'm going to put my gloves on, explain the procedure. I'm going to remove your old dressing, Mr. Watkins, and look at it and just see what kind of drainage you're having and see if there's any blood in it or if there's any foul-smelling odors or any signs of infection, okay? So I'm only going to expose the area. Now I'm going to have to, for y'all to be able to see it, I'm going to really have to expose this person, okay? I would want to put him in a position where when I irrigate it, it is going to drain, okay? On a real person, this is going to work a lot better. On our mannequins, it doesn't work that great. So I'm going to put an absorbent pad down, okay, below this wound. I'm going to have a trash bag here to remove my old dressings, and then we'll put a towel over that, okay? So first I'm going to remove the old dressing. And just like we did with our ostomy, when we remove the tape, I'm going to pull it towards the wound. I don't want pressure on the wound to make it open any further, okay? So I'm going to remove that tape towards the wound. This should be completely dry on the outside. This is my ABD pad. So I'm hoping there's not any blood or any pinkish drainage on it. Okay, and I'm really careful. So every layer, I do one layer at a time, and I'm observing to see if there's anything on it, okay? Your instructor will tell y'all, okay, that has pink drainage on it. Okay, that has yellow-green drainage, okay? So that you'll know what to chart. I'm going to remove one layer at a time, inspecting every bit. Okay, and I don't see anything. And here's my packing. It should come out easily, but if it sticks, remember, we're going to pour normal saline on it to get it out. This is when we get to the sticky part where it really doesn't feel very good, okay? Now you won't do an abdominal assessment on this patient, you're going to do a wound assessment. So when you go to SIMS charting, you'll find wounds and you'll click boxes. So I'm looking at the wound. I shouldn't see any signs of infection in the wound. I should see approximated edges, okay, no jagged edges. I shouldn't see any black marks or signs of necrosis. I should just see new tissue forming, okay? And I also want to see a dry bed in here. I shouldn't see water pooled inside my wound. If water sits in a wound, it cannot heal, okay? So we want to make sure that's dry. I'm going to inspect the skin around it. It should be dry and intact. If we and I'll show you that when I begin to dress it, we fold our 4x4s like this, close to our wound. We wouldn't leave them out like that wet because that macerates the skin around it. That means it gets it wet and it begins to break down. Skin that stays wet breaks down, okay? So my wound looks really good. I'm going to pretend I just had a little pinkish drainage on my packing and that was it. It's looking like it's healing really well. So next, I'm going to measure my wound. When we measure a wound, and there's several ways to do this, we have all kinds of measuring guides. We have these, okay? They're disposable. You use them one time and we throw them away. So we'll have different ways for y'all to measure your wound. We're going to do it in centimeters. Even our little Q-tips that we use. Let me show you one. I was hoping I had one. Here it is. We use these Q-tips to measure wounds, and especially the depth of a wound. So it's on here. So we touch the outside of the wound, okay? We hold it above. Miss Knight does a great thing where she holds her pinkies like this so that it never touches the wound. And we're going to approximate the longest length of it, okay? And that goes to 10, so it's start over. So I'm going to say it's approximately 13 centimeters in length. And I'm going to have a notepad and I'm going to write this down. Then I'm going to find the widest part of my wound and I'm going to measure the width of the wound. And that's also approximately 3 centimeters, okay? Then I'm going to use a Q-tip, and this is how we do the depth. We go to the deepest part of the wound, we gently put that in there, and our fingers go to the top of the wound that's flat against their abdomen. Does that make sense to y'all? Mm-hmm. Okay. So we go to that, and then we lay it against here to measure the width of it. And that's approximately, and that's what we say. If it's not exactly, we say approximately, okay? So I have measured my wound. I'm going to make sure I put all those measurements down. Okay? All right, now I'm going to change gloves. How are you doing, Mr. Watkins? Are you still okay? Now I'm going to irrigate the wound clean, using clean technique. So, I want to show y'all why we're going to have to do this a little different. There's several ways. We have little irrigation trays that come like this. We open this up. I used this yesterday. I wanted to show y'all how this does it. So these little trays come, we open them. They have all kinds of neat stuff in them. Let me put this back. This is all clean. I would use my normal saline or whatever the doctor wanted me to use. I'm going to pour my liquids in here. And I'm going to irrigate it. When I irrigate it, I'm also now going to add my emesis basin to try to catch all of the irrigation fluid that comes out. Now on these mannequins, guys, it's not going to stay where you want it to, okay? Sometimes we even enlist the help of our patients and say, can you just hold that down there for me? Or you'll have a second nurse. All right, I want to show y'all what happens while we can't use, we bought all these trays for y'all to do, their irrigation trays. But let me show y'all what happens when we use this one. And I've tried to get it to loosen up too, to see if it would work better, and it's still not. When we irrigate, we don't go back and forth and back and forth. We go in one direction. We go from clean to dirty, okay? So we start at the top and we go straight down. Watch how this water comes out of this syringe. Did you see that? We can't do that. It cannot splatter everywhere. So I have tried to loosen this syringe. It just won't work. So we're not gonna use that. I'm gonna have another syringe out for y'all. This is still just a clean technique, so as long as it's clean, we can use it. So I'm gonna get my irrigation solution, and I'm gonna stay within these margins of the wound, and I'm gonna go from top to bottom. And then I go back up and go back down, okay? You can also do a zig, if it was a really wide wound, you could do a zigzag pattern, back and forth, back and forth, back and forth, okay? But just don't do this. See how I'm over here on the outside of the wound? We don't want to do that because this could be dirty out here. So the best way to do it is just start from the top and keep going down. And how long would we irrigate? We would irrigate until we are, the solution or the water, that's the saline that's coming out is clear instead of red or pink, or it's free of debris, which means it's free of any kind of loose blood clots or anything that's in the wound, okay? So clear or free of debris. That's how long we irrigate, okay? So now I'm through irrigating. Now I'm going to, and I would have some little 4x4s. I can open those. If I did get the skin wet, I would take this and go straight down to dry it, turn it over, go straight down to dry it, dispose of that. If I had any water, irrigation fluid, that is pooling in my wound, this wicks it up, and I would just gently tap this in here to get any excess fluid out, okay? In one direction, top to bottom. And I'm going to get rid of that. Next, I'm going to obtain my culture, and I'm going to put this in what I see is the dirtiest part of the wound. And to do that, I go in, and then I'm going to rotate my swab really well. I want to cover my swab really well with whatever's in here so they can get a good culture, okay? I'm going to remove it. Be very careful to not touch any of the sides of this and just go straight in. Then I'm going to label this with the patient's name, name, date of birth, my initials, date and time, and get it to the lab, okay? So I'm going to set that away. All right, now I'm ready to pack my wound. So I can take these off at this point. I've got all these extra supplies out here. Let me get my tape ready because I'm going to need that in a minute. Are you still doing okay, Mr. Watkins? I really don't need this up because it's going to be in my way. Yeah, it's going to be in my way. So I'll just put this here for now. Okay, so what do I need? This is where you're going to set up your sterile field. We'll have all this out here waiting on you, okay? Move that out of the way. So, this is how y'all going to do this. I'm left-handed, so in a minute I'm going to show y'all how you would do it right-handed, because you will do it different than me. I promise. We got to have a trash can close to us. Okay, so this is what we need. I'm going to need my sterile drape. Y'all are going to, we have sterile drapes. One out over here to show you. But for y'all to practice and do it over and over, you're just going to pick it up like this. We would open this sterile drape, and then we pick it up. Remember, we have that little border. The shiny side always goes down. So it'll be folded where the shiny side is on the outside. You're going to pick it up by the corner. Okay? Only touch the corners, and we're going to put it right here. Now, put it where it's the thinnest, okay? Don't make it really wide because you're going to need room on both ends, okay? Make sure when you're setting all this up that you've got, you're not going to turn your back on your sterile field when you're ready to do your irrigation, okay? All right, the things I'm going to add to my field that I'm going to need some of these Q-tips. This is what I'm going to pack my wound with. We have forceps that are plastic, and they stick to our 4x4 so bad we've stopped using them because when y'all are trying to pack it, it pulls your 4x4 straight back out, and then y'all mess up your sterile field, okay? So we're going to use these little Q-tips. So remember what I said, when we open something, we quickly do that. We're going to drop that. I'm going to need some cover bandages. that are gonna be dry when we do wet to dry. These are my dry ones. So I'm gonna wear those. I'm gonna need an ABD pad. This is my pad that covers my wound entirely. Now, just drop them on here for now, because we're going to, once you have your sterile gloves on, you can move all this around and put it where you want to, okay? Next, I'm going to open my 4x4s, drop those, put my container here, okay? Let me make sure I have everything I need. I'm gonna put those in there. I've got my dry ones, I've got that, I've got that. My tape is close by me. Where did I put my tape? Put my tape here. My gloves are gonna go here. Now I'm ready to pour my liquids. Remember, I've palmed it. We'll talk about that too, whether it's open. If it's never been opened before, you make sure that you put your date, time, and initials that you opened it. If it has, lip it first, okay? I'm gonna pour my liquids right here. Okay? And now you're going to put on sterile gloves, guys. So see, we have very small amount of room. Sometimes we put sterile gloves on our patient's bed, but it depends on where their wound is, and it depends on how infected it is, okay? If it's a pretty clean wound, as long as my bed is up at my waist height, I could put it on my bed, but I want y'all to practice doing it here. So I'm going to come here. See, I'm not turning my back on my sterile field. So I'm going to come down here, and you may touch this here, but just try to stay within this 1-inch border, okay? And don't put, like if this was right here, then these two can't touch, okay? So try to hit the middle when you dump all your things out, okay? So hopefully this won't fall off while I'm trying to demonstrate this for y'all. I'm going to put my sterile gloves on, and we try to do this in a timely manner, because I don't want his wound just staying open. What if there was a fly in here like there is in our classroom? Okay, I've got these on. I'm going to let that drop. Now, I'm going to arrange all my things and get them ready to apply. You're going to put most of your 4x4s in your water here, okay? I'm going to leave those two in case I need to dry that wound. I've got those two cover ones. The rest of them I'm going to drop in here, okay? So I'm going to pick this up, and I'm going to drop them into my container. All right? Now, this is how we're going to pack this wound. We don't want sopping wet 4x4s in our wound. Our wounds have to have air. I'm sure Miss Knight told you this. If you pack a wound too tightly, it cannot breathe and it will not heal. So we're going to squeeze the excess water out. Okay, we don't want sopping wet. And then I'm going to loosen this up. I learned this from a great doctor, and we did a lot of burn treatments, and he taught me a lot about wound care. So real carefully, don't let this flop everywhere while you're undoing this. But this gives it more air into your wound. I'm going to make sure I hold it all tightly in my hand though, and I can't leave it as wide as this, guys, or it won't go in my wound. So we're going to make it thin. Okay, now I'm going to grab my Q-tip here, and I'm going to go straight to here. Hold this straight up. We want it to go directly into our wound, okay? And now I'm going to start packing it. I want to cover all my wound edges, so I'm going to get it to go down to the end, but I'm controlling it with my hand. Do you see how I'm holding it up? Where it doesn't flop over here to here? If it does, that has to stay there. It cannot go into your wound. That's considered dirty, all right? So that's why we have to control it with our hands really well. Now I'm going to go back down. Really, guys, with every wound that y'all are going to pack, it takes about 2 of these. Okay? See how it's even sticking with this? So you're going to take your time. That's what I mean, but y'all have to come in here and practice this. I'll have wounds on all the mannequins. I'll have everything y'all need. Okay? We're going to stay inside there. I'm going to come back over, do the same thing with another one. We're going to splash it. Okay, we're going to get this undone. This takes a little time. Okay, so now I'm going to pull this up like this and do it again. Stay directly in my wound. Okay. See that one that came out? Shouldn't go back in there. You beep, beep. All right, let's say it went in there really well. Okay, so I get it in there. Now I'm just going to throw that away. Now I'm going to put 2 wet 4x4s over that because I want that gauze in my wound to stay moist. Okay? So I'm going to take this 4x4 and I want you to fold it in half like this. See how I fold it in half? Put it on here. Do one more. I don't know how that came undone. Because we don't want to macerate the skin. Tell your instructor that. Say, I'm folding it in half because I do not want it to macerate the good skin surrounding it. Now I'm going to come get my 2 cover sponges. These are my dry ones. They're going to lay on top of that. Okay? And lastly, I'm going to get my ABD pad. The blue line goes to the outside. That's for x-ray purposes. Okay? So we put that here. That lays over that. At this point, I'm done with my sterile part, and I can take my gloves off. Now I'm ready to tape it. Let's talk about this. I want all of y'all to bring a Sharpie in your pockets this week. And we will, before you tear this first piece of tape, we even do this thing where we make a little tab. Okay, that's our little tab. And you're going to put your initials, date, and time. I want you to do your first piece of tape diagonal, okay? There's a reason for this, and it's an unfortunate reason. Okay, and we try to let our tape just go right past our wound. We don't need tape up from here to here, right? Okay, so that piece of tape has our date, time, and initials. It's on the very bottom, because let me tell you what bad nurses do. They don't want to do their wound changes, so they'll come and take your piece of tape off the top and they add their tape that has their date, time, and initials like they changed the wound. So if you put yours on the bottom and then secure every side on top of that, then they have to take off. It's a lot more effort for them to get to that piece of tape. And if they've got to take all that off, they might as well do the whole dressing change, okay? So that's what I want y'all to do. Can y'all remember that? Unfortunately, people just don't do what they're supposed to do. Y'all, that's not supposed to be wet. All right. So we're going to secure all sides for more than one reason. We want to keep all bacteria out of it, and we don't want any leakage. Okay, we don't want it to leak all over our patient. So that's why we're securing all 4 sides. Put that first piece of tape with your date, time, and initials down first. Okay, so we're done. Now we're going to check back in with our patient. Mr. Watkins, did that cause you any pain at all? What is your pain level now? Check in again. Especially if you didn't medicate him before, do we need to now? Okay. Now, what should we do when we've got a wound? Wound healing, I'm sure Ms. Knight told y'all last week, requires very good nutrition. They have to drink lots of fluids, and what kind of diet do they have to be on? High protein. So we want to emphasize that with our patient. You need to drink, you need to be eating, so we need to find things that you like, and especially some high protein. We might even go get them some protein shakes. Just why? A lot of diabetics, especially that don't heal well anyway, they will put them on a very high protein diet, okay? And a high calorie diet, just while their wound heals. You'll find out later, especially when you go to RN school, if they're a diabetic, they will, even if you're not on insulin, they may put them on insulin to keep their sugars really low so that they will heal. Because if their sugar stays over 200, their wounds do not heal. So they keep a tight check on their insulin levels too, okay? All right, so then of course I would do my exit routine. I'm gonna make sure they don't need anything else. I'm gonna make sure they get some water. We've already addressed their pain. We've done our teaching. So I'm gonna put my bed in the lowest position, side rails up, call out and reach, and tell them when I'll be back to check on them, okay? Your doctor will let you know every wound is supposed to be changed in so many hours, okay? So it will tell you whether it's BID 3 times a day, when saturated, okay? If it's a wound vac, it's totally different, and y'all will learn all about that when y'all follow the wound nurse. Okay, any questions? So it's clean, procedure until you're going to pack it. So I'll say that again. When we're going to pack it, and I'll have all the supplies out for you, you're going to make sure this goes down shiny side, put it in the middle, because remember your liquids need to go here, so you don't have to go over your sterile field. So we'll open this 4x4 box, dump it here. We're going to open our Q-tips. We're going to open our ABD pad, and we're going to have an extra pair of dry cover sponges, okay? So you'll put most of your 4x4s in here. I say most. Leave 2 out if you want, in case when you irrigated you had wet skin on either side of your wound, okay? And then your tape, just have ready. You can even hang your tape right here on your table if you want to, so it's close by. Don't forget, after you take off your dirty wound stuff, that you put it in the bag. Red bags are for if it has any blood at all. If not, it can go in the normal trash. But change your gloves after you take your old dirty dressing off before you measure it and culture it. Yes.
Can we write our initials and date and time?
Yes,
whenever it's on the
absolutely.
table?
Yeah.
Can we just go ahead
You
and do
can go
that?
ahead, when you're getting all your things ready to irrigate and getting your supplies ready, go ahead and put your date, time, and initials if you want to, okay? I say that because I just can't stand to see nurses writing on people's abdomen, whether it's an ostomy plate or a wound. It's just not fun. Don't write on them, okay? And I also want you to do it before, because you see all that? That's people who wrote on these mannequins, okay? It doesn't come off. All right, any questions?
So a
Yes.
person who's right-handed would want to.
Okay, yeah, let me show y'all that.